And then our final presenter is Tony Chicotel, staff attorney at the California Association for Nursing Home Reform. Welcome, Mr. Chicotel. Thank you for being here as well.
Good morning, Chair Gonzalez and members. Thank you for inviting me to speak today. My name is Tony Chicotel. I'm a staff attorney with California Advocates for Nursing Home Reform, also known as CANNER. I'm testifying today on behalf of nursing home residents. Residents around the state are scared, angry, and frustrated. We need to learn from what is happening to improve long-term care. It's not blaming or punishing when we examine systemic weak points and failures. It's fulfilling our public commitment to assess and to grow. Much of the devastation in nursing homes has been avoidable. We have had decades of feeble state leadership and half-hearted enforcement from DPH. We have a public payment structure that divides facilities' interests from residents' interests. We have created the environment in which pandemics will kill nursing home residents with horrific success. When COVID hit, nursing home residents and staff were sacrificed in favor of other healthcare providers and patients. There were many fatal missteps. For one, surveyors, ombudsmen, and families were excluded from facilities, creating a massive loss of oversight and direct care. Some of the worst facilities in the state are being designated as COVID-19 facilities. Since March, California has performed over 1,300 infection control surveys and did not issue a single infection control deficiency as a result. The surveyors were told not to issue deficiencies and gave clean bills of health to facilities that were in the process of experiencing enormous COVID-19 outbreaks. And now we have 2,000 residents dead, over 2,000 residents dead, 10,000 residents infected, and almost 6,000 staff members infected. We get the outcome our system is designed to provide. There are no surprises here. Well before COVID, the CDC estimates that 388,000 long-term care residents die annually from infectious disease in our country. We put our sickest, most frail people into crowded buildings with insufficient staffing, run by business people whose ultimate goal is not to provide good care, but to take profit funded by taxpayers. Incredibly, providing good care is not aligned with profitability. This is not just fact, it is the product of design. The vast majority of nursing home revenue comes from the government, and the government has proven to be an impulse shopper, using its heart and not its head when it shovels over $5 billion every year and is poised to give an enormous, no strings attached raise this month. CANNER has submitted a 10-point plan for statewide long-term care reform. Here are some of our most important recommendations. Related to enforcement and accountability, enforcement is weak. Complaints against nursing homes have exploded. Violations like bad infection control are commonplace but are not discouraged because of a lack of fines. 99% of infection control violations are called no harm. Providers have sought blanket immunity for wrongdoers, even if they commit gross negligence that causes death. What we need, what we have long needed, is to empower residents and victims of poor care to do their own enforcement. DPH has proven for decades that they can't get this job done. Staffing. Our minimum staffing standards are too low and are often violated. We need to raise the staffing minimums, particularly for registered nurses, and dump the waivers that give facilities a pass to provide less staffing than the minimum. There's budget legislation right now where these simple reforms could be added. Ownership. Our worst operators take over nursing homes without licenses and squat there and profit for years. Throw out these operators who don't have licenses. The holes in the ownership approval process have been exploited mercilessly, and CDPH has done nothing about it. Budget. Steer our public resources to home and community-based settings and away from nursing homes. In other words, do the opposite of what the governor has proposed in his budget. Emergency preparedness. We now have a pandemic colliding with wildfire season. The Senate will soon vote on Senator Jackson's SB 1207, which will ensure state compliance with a federal standard that all nursing homes have at least 96 hours of backup power to keep residents safe during a blackout. I urge the members to vote yes on this very simple but important bill. There's a tremendous opportunity here to change the way we provide long-term care in this state and improve the quality of life of hundreds of thousands of people. This pandemic has not broken the system, it has revealed it. The system does not prioritize resident experience. Residents are bystanders and too often victims. This needs to change. For any senators interested in reform, I urge you to contact me, and let's get to work. Thank you again for this opportunity to testify before the committee. It's an honor to speak for residents who are in such great need of comfort and assistance at this time.
Thank you very much, Mr. Chicotel. We appreciate your testimony also.